My life, I've been in education, and I've learned how important it is to go with evidence if you want to change things. And so for me, this eBRAIN is the next way of contributing to the evidence, because if I can give the data and that data can be used to help find new ways of improving care or finding treatment for Alzheimer's, then it would be wonderful. I also need to be part of it, because then we feel we're contributing to the progression of the study. The first project I was in was EPAD, and there were no one with Alzheimer's in that project. Now since then, that was 2016, since then I've been to several conferences, and each time there have been more and more people with Alzheimer's disease. Now this is one of the best ways of breaking down the barriers about how people think of Alzheimer's, because each person with Alzheimer's is so different, and we need to, for the general public to know that, and we need it for researchers and for the people themselves to discover how to live well with Alzheimer's.
Hello, my name's Jane Goodrick. My husband has mixed dementia. His name is Chris Roberts. We live in North Wales, and we have found being involved with research so empowering. It gives us so much value, and we're doing something for the next generation of people with dementia that are going to come after us.
I'm Sheila Robinson. I live in Madeley in Cheshire, in the centre of England. I'm a mother, a grandmother, a poet, a Quaker, and I have dementia. It's a relief to get an actual diagnosis, because I think we all know, we may not actually dare to put the name to it, but we know that something's really wrong. And so to have that confirmed, it seems a strange thing to say, but the relief of having it confirmed, because then you can make plans, then you can, decide what's important to you, make whatever decisions you need to make about the present moment and the future.
Being involved in research necessarily entails that lots of data and samples will be collected, because without this information the researchers can't do their work, and then we would be left with no hope. It is so important that we do share them, because then things will happen much quicker, instead of people doing their own research in their own little silos and perhaps replicating what somebody else is doing perhaps in a different country. Without the data, without the samples, none of us will get anywhere.
I think it's vital, because this is a battle, and public involvement is part of the battle, and being part of it. Somehow we have to do something to get rid of this disease, and public involvement is one of the ways of doing it, whether it's about information, about research, whatever we're doing. It's all going to help in that battle.
And being involved in public research, one of the main things, the tangible things that I've seen, is the retention of the research participants, because we've been involved in producing the literature, the paperwork, the questionnaires. When it can be very scientific speak, we've been able to use our normal
lived experience speech, really.
Yeah, what we would say in real life, but without losing the authenticity of the research.
And I think authenticity is a really important word. It is authentic. It's from the grassroots, isn't it?
Yeah, and if you're getting it from the mouths of the lived experience or the carers, then you actually have you're confident of that authenticity.